Hello, you're welcome to another educative and insightful edition of HealthAfrik on AAU television. You can watch us on Association of African Universities on Facebook and Association of African Universities on YouTube. You can also follow us on our Twitter handles AAU_67. Okay, so today we are talking about job stress and mental health. And I have with me here Dr. Eugene Dordoye. He is a senior lecturer at the University of Health and Allied Sciences. And talking about job stress, I know you're wondering, does a child go through stress? What is stress like? Who undergoes stress? And how is stress related to mental health? All these questions will be answered right here on HealthAfrik. Please stay tuned. We are going on a short break. When we come back, I'll introduce my guest again, and then we can get started. Please don't change the channel.
What do you think about when you think of success?
Success is about hard work. Success is about knowledge and applying it for the good of the community. Success is about skills development. It's about creating innovative ideas and building a hope and making it a reality. Success is about having big dreams and chasing them. Success is nurtured here. We as National University of Science and Technology stand as the only key you can use to unlock doors for success. When you think of success, think in other terms.
You're welcome back. If you just joined, then you're watching us from the Association of African Universities Facebook and YouTube, and this is HealthAfrik. Okay, so I'd like my guest to introduce himself. You're welcome, Doc.
Thank you very much for having me.
Okay, so please introduce yourself.
Yeah, I'm Dr. Eugene Dordoye. I'm a senior lecturer for the University of Health and Allied Sciences, the School of Medicine. Yeah, so, and I'm a consultant psychiatrist at the Volta Regional Hospital. Yeah. Okay. And then I have a clinic which I run, which I'm the director of my Mate Clinic. For the Faculty of Psychiatry at the Ghana College of Physicians and Surgeons, I'm the secretary. Yep.
All right, it's wonderful having you on the show.
Thank you for having me.
All right, I'd like us to go into the issues for today. I'd like us to strike the relationship between mental health and job stress.
Yeah, the relationship is very simple. Okay. Stress is mental health. So really? I'm surprised at what you're talking about. I mean, when we say stress is basically a condition or a state we find ourselves when we are not able to harness our resources, that is what we have to be able to overcome stresses. Okay. So commonly people refer to stressor, that is stress with an OR. Okay. As the stress, no, but the stress is the disease condition. So stress is a mental ill mental ill health. So when you say you are stressed, it means you have a mental condition. Yeah, so normally we are expected to be able to handle life stresses, which all of us will go through. I mean, nobody escapes from a life stressor. So, but when life stresses come at us, we manage to handle them psychologically, emotionally, physically, yeah. So it is when we are not able to overcome them, then we are stressed. And this is basically the mind that is stressed. Okay. And when the mind is stressed, unfortunately, the mind controls the body. So it can give you body symptoms, which appear as if you have another general medical condition. But in fact, it's because your mind is overwhelmed with what you are going through. And that is what it can present as.
Oh, okay. So the mind controls the body, and then, okay, so what are some of the causes of stress then?
Yeah, it's like I said, I mean, the causes are when we are not able to overcome the stressor. So probably we can look at the stresses itself. What are the stresses?
Yes.
Some of them are natural and they come, like birth, death, promotion, demotion, marriage, divorce. These are life events that they will naturally come to us. I mean, you are born and you are born to your parents, and the challenge of going through how to care for a new child is a stressor. When you finish school, you are going to get employed. You've never been employed before. The first time we are going to now assume work is a stressor. Even when you receive your first salary, sometimes the salary comes in double or triple because you are not paid the first month. So, and nobody is paid before you start work. So the first month you start work without salary and you still have to perform, that is a stressful period.
Really? I thought that was supposed to be joyful, like you're happy.
It's
you have
joyful,
money.
you have a job, but how do you get a job done? How do you get it done without making mistakes? How do you get it done if your boss does not accept mistakes? How do you get it done when you don't drive yourself and you have to get to work on time, and now the trotro you take stops on every spot? Yes, and I don't think your boss will come and say that because your trotro is stopping. Yeah, so now you have to overcome the challenges of waking up on time and probably looking for accommodation. It's quite sad that we have in the country that when people start work and people need accommodation, they have to pay for 2 years advance. These are people who have never worked before, and we expect them to be able to raise the money that people who have been working for years have to come by. So that if you may get a cheaper accommodation, unfortunately that will be far away from where you work. And that also means you take vehicles, a commercial vehicle, many times before you get to work, and that is a big time stressor to get to work. So there are some stresses that we don't have a choice, they will come to us. You get a new job, you have to manage your boss, or even if you are employed as a boss, how to manage your subordinates. These are all stresses that come to us. So we are supposed to be able to harness resources available to us. These are, for instance, if you are very skilled at your job, if you are well trained, then the stressor of impressing your boss or doing your job well, because you are already well trained for it, the stress level goes down. But if you are put in a job which you've never done before, which is the situation in a lot of graduates, because the university trains you how to think. It does not necessarily give you skills on what to do. So when you get to the job place, you are now going to determine what to do. And that is where, and sometimes we treat you as if you've been working for ages. Yeah, it's a way we make young people feel that as if we treat you as if you are. If you're a doctor, you see the emergencies first. And I can recall the first time I was at the emergency after I finished medical school, and I hear the siren of an ambulance, I panic. Because I was the only doctor in the emergency room. The nurses are looking up to me to perform. And I have no idea whether what is coming, whether I know what the condition is, or how to manage it and all that, but you are there. Yeah, so these are stresses that people will go through. Whether you like it or not, you're going to be the first time at work, you're going to do surgery for the first time, you're going to do something for the first time. These are stresses. But knowing that you have a support system. For instance, I was at the emergency, and I know very well that I had seniors who I can call if I needed help. So that is a resource available to me. We had textbooks in the emergency library where you can just go in and refer So that's also another resource available to me. We have nurses there who have been working there, so they've seen how other doctors have managed. These are resources available to you. So if you're able to use these resources, harness the resource available to overcome that fear of seeing an emergency situation, then we say you've been able to manage it. But if I am broken down and start crying and throw my hands in the air, yes, at that point I may want to pee at the same time. I'll start sweating. But it's all because I've not been able to overcome that stress of seeing a patient, an emergency patient, the first time. So when we are not able to overcome such stresses which will come to us anyway, that is when we are stressed, and that is when we have symptoms which will run from the head to the toe. You start sweating, your heart starts beating faster, you feel like you want to poo, you may get a diarrhea, your body may start itching, you obviously will get a headache at that time, you lose appetite. Sometimes some people may actually feel like vomiting, there might be some chest pains, you feel like you are choking. You can get severe abdominal pain because of that. So stress can give us symptoms on all over our body. The challenge sometimes we don't realize is that we don't realize it is the mind which is giving us those symptoms. We refer to that as psychosomatic, meaning that psyche means mind. So psychology, the study of the mind. Soma means body. So psychosomatic is a mind problem giving you body symptoms. And that is what stressor can do.
So can stress lead to other medical conditions?
Many of them.
Wow.
There's one which commonly doctors, young doctors will miss. It's called the chronic fatigue syndrome. That is when you've been stressed over a period. You begin to get symptoms like a low-grade fever, headache, you feel unwell, general malaise, and it looks like a malaria kind of, at least signs of a typhoid fever. Something is happening to you, but all your labs will be normal. So then doctors then throw their hands in there and want to manage something for a malaria or something, but it is because you've allowed stress to accumulate, and now they give you symptoms as if you actually have a body symptoms, but your labs are all normal. And that is where that challenge is. In people, we say they are suggestible. That is, people who are prone to getting mental illness like an anxiety disorder. A stressor can easily trigger them into an anxiety disorder. And for anxiety disorders, we get people who get panic attacks. They easily become afraid that something is going to happen to them, or they may die, their hearts will start beating. They can come as if they have a heart attack. And that is that, and that fear that they will not be normal, that can happen. Sometimes people can present with, fear of an enclosed space. And that is also there. People can have what they call generalized anxiety disorder, where they begin suddenly to realize that everything is dangerous. The staircase I'm walking on, it may break. This roof we have here, are we sure it will not cave in? No, so suddenly fear grips you. And when fear grips people, they are not able to function. Because even the vehicle I would join to come here, what if I get an accident? So that fear grips you and you're not able to do anything. So it can lead to any other thing. The other challenge we have with when people have stressor is that they feel sick, they will go to a hospital, they do their lab, the doctor will tell them that your labs are fine, so therefore you are fine. But they feel sick, so then they will change doctor. We call that doctor shopping. So they move from one doctor to the other for somebody to just prove and have something to check and show that yes, you are sick. Unfortunately for them, no lab test will show that they are sick. So they are the only people who feel sick. And they are the only one having the symptoms, and it's appear nobody understands them. In our society where we are so religious, the church is the next place to go. So then they go for all-night services, and unfortunately, keeping vigil is a stressor. So that will worsen their plight. Yes, so they will go for the prayer meetings and then feel worse than they went in before, because the underlying cause was a stressor, which they are not removing that stressor from there. So they continue having challenges. Sometimes some of them may lose their jobs because they will say that it's only when I came to this job that the evil spirits are following me. There are no evil spirits, you know. It's not that I don't believe in evil spirit, but most of the things, stress can cause them, and we need to understand these things that can happen. Okay. Stress can lead to, unfortunately, real problems. Okay. That is, people who have hypertension or diabetes, or people who are prone to getting a heart problem. If they are stressed again, their tendency of getting a heart attack increases about 3 times more than the general population. So they can get a heart attack, they can get a stroke, a brain attack, the same as a stroke. They can get other conditions that make them worse off. So things which may happen to us normally, people who are stressed get it more, they are easily getting it, that they have the likelihood of getting it easier or getting a severe form of it. So unfortunately, stressor in itself might not necessarily kill you, but it can trigger a condition you have already that can kill you. So stressor is something significant that we can talk about. You asked earlier about what will cause. So at the workplace, there are so many things that will make us stressed at the workplace, if I should talk about that. One, you may have a supervisor. When the demands of the supervisor are so high or overwhelming, that can be a stressor. For instance, you have a supervisor who is a perfectionist. Everything has to be done
to perfection.
Yeah, I mean, you dot every I and cross every T and make sure the line is straight. I mean, you arrange books, then they come and just tilt it a bit that it wasn't that. Yeah, so we have such a boss. You almost never do a good job. And such a person, I mean, can be a stressor to the subordinates.
So how do you deal with how do you live with such a person? Because if I'm in the same environment with you and everything I do doesn't seem perfect, you know, sometimes it's really stressful and you don't even want to work again.
Yes. So you should identify the problem first.
But he's
there should be
a
diagnosis. Yes. So once you know it's a perfectionist, you don't expect to be able to impress that person.
Oh, okay. So you should live with it that you can't impress.
Yes. Okay. So there are what we call the 4 A's of stress management. Okay. You either accept the situation as it is, you adapt to the environment, you alter the environment, or I mean, you do something to make sure you can live with it. It's not everything that you can change, you can alter. It's not everything that you can accept. It's not everything that, I mean, so you move to know which of these ones would work. So if you have a perfectionist boss, being able to diagnose or know that that boss is a perfectionist is enough. Oh, okay. I usually quote one of my patients. You know, she had a panic disorder. With a panic which can be caused by stress, they fear something they get a sudden fear that they are about to die. It's like a heart attack. So she was rushed in. The second time, third time, I diagnosed and explained to her, I gave her information and told her that it does not kill, but it always comes that you feel like you are dying. As soon as I made her understand that one, So what should she do? Say, when you come, just sit down with time, or the maximum 30 minutes, it will go away. It's so okay. And I stopped seeing her. She stopped coming because now she realized that, okay, this thing does not kill. And it's true, panic disorder does not kill.
Okay.
But it makes you feel like you're about to die. Yeah, so once you know that this is what you have, and when it comes, it will come again anyway. When it comes, just sit down, wait for some time. It will go away, and it won't kill you. And it didn't kill her. So knowing your boss is a perfectionist is one thing. And once you know that you are going to, you will never be able to impress your boss.
Yeah.
Sometimes your boss might not be aware, him or herself. You can make it, clear to the boss that, hey, even an excellent student does not get 100%. You are aware.
My boss should be listening.
Yes, when you say you are excellent, you are getting about 70 or 80%. It's not 100% that makes you excellent.
Yeah.
So even the one who was excellent got 20% wrong. So obviously, I'm not going to get all right to be excellent. So to do a good job does not mean, or to do an excellent work does not mean I got all right.
All right.
I cannot get it all right. I'm human. So yes, so probably you can help your boss appreciate that, yes, what the whole world calls excellent is actually not 100%. So, so probably when I do one, let me know that the 10% wrong. Yes, and that means I still did excellent if I got 10% wrong.
90.
Yeah. 90% is super excellent. Yeah, so I got 10 of them wrong, but I got 90% right.
Yeah.
Yeah, so some bosses can be made to understand and know that. But if they don't, you should also know that, well, she only showed me 10% of what I did wrong. So you can pat yourself at the back that I got 90% right. Yeah, so that is that. The other stress at work is when we don't have the tools we need to do our job with. And that can be very, very stressful because you've been trained to do a particular job. You know you can do it the way it should be done. Yet you don't have what it takes. And that makes coming to work, very difficult because apart from the salaries we get from work, there is something that makes us happier. When we work. So, because what you call, it's a social function. That is what you exist to do. Yeah. So when you don't do what you have to do, that is in itself a stressor. So when we don't have the tools we need to work with, yeah, that is a stressor. The same way applies to the environment in which we work. If you don't get a conducive environment to work, and the environment include the people you work with and the physical structures. Yeah. So that if in this studio we feel the roof may come down anytime, I'm sure we'll keep looking up and see whether, and that is a stressor. So when I'm coming back to work tomorrow, you wonder whether I should come, whether I should sit there again. So that is a stressor. If, your workplace is full of people who don't like each other, who fight each other, or, there's some rat race somewhere. Yeah, people come to work and they are afraid of what is going to happen next because my neighbor, my colleague at work is backbiting and all that. So the people around where we work with, when they don't accept us, when they are not okay with us, that can make us also quite stressful, you know. Okay. Yeah, and then when we have targets which are not surmountable. Some targets are just not achievable. Or even when they are achievable, you are not supported to achieve them. And here is again to the supervisors. Everybody needs support. So when people are not supported to achieve what they are supposed to achieve, yeah, that can be a big time stressor. And they need to be, The next thing is working for long hours without break. Yeah. We need to have breaks. We need to have leave. Sometimes we work, especially those who work in the IT departments, they tend to be workaholics. But they need to actively make time that, no, I've worked for 8 hours today, I need a break. I have worked for, because a study has shown that even our mind concentration goes down when we continuously work. So it's always better to take a break after an hour or two. Just walk around and come back. So that is in itself a big stressor. One other stressor at work, which unfortunately in Ghana we don't look at, is what we call employee assistance program. Many employers don't care about the health of their employees. So that if I know that coming to work today, if I get injured at work, I am on my own. That is a big stressor. Because when I'm coming to work, I'm thinking of making sure my kids, my family is safe, I am safe and all that. That shouldn't be my burden. I must come to work when my family has a medical problem. When I am sick myself, my employer should be able to take care of that. So that should not be added to my challenges, because it is the work that gave me that problem. And in France, it's been argued out in courts that as soon as you leave your house for work, you are at work. So everything that happens when you're boarding the trotro to the time you go to work is part of work. So your employer is responsible. So if you get injured while picking a trotro, if your dress get torn while picking a trotro, it's still your employer's responsibility. But how many of us can activate that in Ghana? And that is where the challenge is. So if we don't have this support system, and I'm sadly to tell you that even in the health system, this support system for health is not still there.
God.
Yeah. So, and this is a stressor on people. No, I mean, it's quite sad that even health workers do not get, I mean, health support. And that is something not, I mean, good at all. So our work environment should be such that we should be happy going to work. There's a study, I mean, done in the US about what they call the we effect. That a company achieves more when the employees feel a sense of belongingness. That yes, I come and I see my colleague at work more like a sister or a brother to me. I'm happy coming to meet you for us to, because I know that after work we can have lunch together. That we effect make productivity increase, and employers are supposed to, I mean, facilitate that we effect at work, and that would help them reduce the stress at work. Unfortunately, we do not have such things
in Ghana.
We are hoping to work. We are working towards it.
Oh, why? That's nice. Okay, so the we effect, it's, you know, going to work and knowing that you're working with people who feel your family, you eat together, you're happy at work. Picking a trotro to work is not stress. That is a stressor in itself, but since you're meeting people in your organization and then you feel together, there's a sense of belongingness, it's enough to make you happy. We're going on a short break. Please don't leave.
Botswana Accountancy College is a business school that was set up over 2 decades ago to contribute towards the human capital development in Botswana and beyond. BAC has over 20 years diversified its product portfolio to offer accounting, business, leisure, management, and ICT-related programs at undergraduate and postgraduate levels, as well as consultancy short courses to augment professional skills. In achieving this diversification, the college has partnered with UK-based universities of Derby, Sunderland, and Sheffield Hallam University, as well as professional bodies such as SEMA, Beaker, AAT, ACCA, CIA, Cisco, Microsoft, SAP, ESA, and SIPS to allow our graduates to have a globally recognized qualification and be globally competitive. To learn more about BAC, contact us on 3953-062 in Gaborone or 241-0558 in Francistown, or visit our website on www.bac.ac.bw. Also, you can visit our social media pages on Twitter, Facebook, and Instagram. BAC, celebrating over 20 years of creating business leaders.
You're welcome back. We are still talking about job stress and mental health, and I have with me here Dr. Eugene Dordoye. Dordoye, all right.
Botswana Accountancy College.
And we were talking about some of the job stresses, and now you mentioned fear or someone being afraid and then thinking that, okay, being here, the roof can actually break in. Don't you think somebody might be thinking about such a thing because the person has actually experienced it, or sitting in the car and thinking that the car can have an accident? You can hear the wheels, and can't it be because someone has actually experienced it?
Yeah, yeah. So if, for instance, you've been at work and the air condition caught fire, of course you're coming back tomorrow and you see the fan, you might be afraid.
Yeah.
So it is the employer's responsibility to provide a safe environment.
Okay.
So there should be a system at work where some of these reports are made, and as soon as they are made, they should be addressed as soon as possible, that employers don't feel safe. Because just not feeling safe at work is a big stressor to your health. Just not feeling safe, because we spend most of our wakeful time at work.
Yeah.
Yeah. So where I'm going to spend most of my time, I don't feel safe there, then my mind can never be stable at work. And that is where, I mean, trade unions come in handy. Trade unions can then push for that. If we don't provide this for staff of this place, we will not allow them to work there.
Okay.
But unfortunately, trade unionism in Ghana works for mostly the government sector.
Yeah.
The private sector, if when you make noise, you can be fired. Because there are too many hands for the too few jobs.
Yeah.
So if you do not want to work in the unsafe environment, quit, which is quite unfair.
Yeah.
We should be able to activate the labor law. We should be able to get people, the private employers, provide safe and secure environment for employees and take away some of these stresses from them.
Okay. And then talking about work environment, you know, there's the formal and then the informal. So the formal normally does work with the mind and stuff like that. But then the one who is on the field doing the labor work, doing electricity, how does that person also undergo stress? Because I think the person will be tired. Maybe you're carrying cement and then you are tired. How does that affect the brain, since the brain actually controls the body?
Yeah. So, I mean, formally we have what we call the mind-body dichotomy, but currently we don't believe there's really a dichotomy between the mind and the body, and they work in tandem. So, for somebody doing a white-collar job, like you said, that is mostly with the mind. But it's very difficult to do a blue-collar job, like even going to read, without your mind. Yeah, so even the laborer uses their mind very well. So it is almost impossible to say that your job does not require your mind. It may not require mostly your mind, but yes, every job will require you to think, every job will require you to be mindful of something. And when we say fatigue, when we are tired and all that, it is the mind that tells us that we are fatigued. It's not the body that tells you. It's a sensation sent to the brain that yes, my legs are tired. So it is still the mind that takes action, that takes part in all of these things. So when people are doing manual jobs or a blue-collar job, yeah, they also get, I mean, a lot of stressor, especially when their contribution are not, I mean, appreciated. And secondly, when they themselves don't see how much their job contributes to the overall success of the organization or the job they do, that is a very big stressor, because every human being wants to feel valued. So yes, I am the one digging, but I still want to know that, yeah, without my digging, this place wouldn't work. And that value that plays on me, that I know that yes, my job is valuable, makes me at peace. If I don't feel that one, I get stressed and doing the job becomes more difficult, because I wonder what use am I digging for them. Yeah, so it is still again the employer's responsibility. So I want to place it on the doorstep of the employer, that the mental health of employees should be the concern of the employers.
Okay.
and that they are responsible to make sure that they are mentally healthy.
Okay.
And stress, as I said earlier, is a mental health condition. And employers should make sure that employees have a healthy mind to work.
Okay, so how then does an employee at work de-stress while at work and on their job?
There are so many ways employees can de-stress. So many of the ways, Okay, so one of the things that you need to do, or the first thing you need to do, is to identify the stressor. You can realize that probably anytime I go and work in this department, I get a sleepless night. Anytime I do this activity, I can't sleep all night. Anytime I work with this person, he says something that I can't sleep all night, that I lose appetite and all that. So once you're able to identify the stressor, that is in itself almost half solved of the problem. Then when you identify the stressor, you need to know whether you can change the situation or you can change yourself. If you cannot do any of them, you would accept it. We'll come to that. So if you can change the situation, then sure, you need to do something to change that situation. For instance, you can make the person clear. I like the way you work, but I don't like the words you use for me. If you can use more polite words without insulting, probably we can work better. So again, people will need to be assertive. Being assertive does not mean you are aggressive. Aggressive is hurting somebody with your action or words. I mean, assertive is making your view or thoughts known to the other person without hurting them or hurting yourself.
Okay.
Non-assertive is also a big stressor. If you are not able to let people know your thoughts and you feel that because you may offend them, you keep it to yourself, that is itself a stressor. So you just need to make people know that you are hurting or this situation does not help me. So make them know without hurting yourself or hurting them. Make your case known. If you cannot change that situation, because probably you may lose your job if you voice it out, you can decide to change yourself. Someone will say that an insult does not stick on you. You can choose to unhear that it is difficult and it will not just come one day. It's not like a switch that you put it on and off. So you must learn that yes, my boss uses nasty words. I will choose not to mind the nasty words. I can give you an example. If probably a mentally ill person tells you somebody you know is psychotic, okay, who does not make a good judgment, tells you that you are a fool, I'm not sure that hurts.
No.
Compared to your boss telling you you're a fool, that hurts.
That does.
But your boss hurts because you have made that judgment for your boss that he knows what he's saying or she's saying. Yes, so you put meaning to that you're a fool statement. And that is why you are hurting. If you consider your boss that, well, probably your boss is just like the other person, that wouldn't hurt. So you can choose to unhear what people say. That yes, he said I'm a fool, but I'm not sure he knows what really a fool is. Probably he or she may be. So don't put judgments on things that will hurt you. Because you chose it. They said that nobody can get you angry without your consent. If you don't agree to what I'm saying, you don't get angry. So you can choose to overlook things. That is when you cannot be assertive to change what is happening. There are situations that are stressful and you can't do anything about it. You have to accept the way they are. If you lose your loved one, that's a stressful situation.
Very.
Probably that loved one is your source of economic power. And you have to come to terms with it. And then look for ways that you can live without that person. Because death is a permanent thing. It cannot be reversed. So we need to find ways to solve this problem. Let me caution, the use of alcohol or drugs is not a way to solve the problem.
It doesn't distress?
It does not distress. Alcohol, for instance, will distress momentarily, but in the long term causes more stress.
Okay.
Because alcohol, for instance, causes an initial euphoria, but in the long term is what we call a CNS depressant, which means that it will depress your brain system. That means you are going to feel sad or depressed in the long run. So the analogy I can give you, for instance, is when you have a fly on your TV screen and you have a hammer close by you, would you want to use a hammer to kill the fly? Why not?
You spoil the screen.
You spoil the screen, but will the fly die?
Yes.
Okay, yes. So your body is the screen, the fly is the stressor you have on that body. So we need to choose the appropriate tool.
Yes.
Probably a scarf, probably some cloth to clear the fly off. Yeah, so we need to use the appropriate screen tool to kill the fly or to get rid of the fly. But obviously not a hammer. Yeah, because when you use a hammer on it, the fly will die, the stress will go away, but your body will be damaged. And when that body is damaged, it will not serve the purpose that you wanted it to serve by viewing it on a TV set. So obviously, it's not the way. When you don't know what to do, seek help. Okay. There's nothing wrong in seeking help. Nothing wrong in seeking help. We don't know it all. No, nobody knows it all. So, and we say that if you've not been to somewhere before, you are those who have been there. If you are going through a stressful situation, you don't know what to do, ask somebody who has been there before, ask a psychologist, ask a counselor. These days it's very difficult to say that talk to a pastor. Because not all pastors are pastors.
Yes.
So talk to a counselor, talk to a trained psychologist, talk to a mental health practitioner, okay? Yeah, they might not necessarily be able to help, but they will point you towards where help is.
Yeah.
And it is nothing wrong in seeking help. Actually, it's the strong and bold who can seek help.
Yeah.
Yeah. So when we need help, let's go for help.
Okay, what about tramadol? Because I know it's a drug, and it's only when you overly use it that you have problems. Can it also be used to de-stress?
Yeah, so I was playing tennis with my son, and then the boy wanted to play more. So, and I thought he was tired. So, are you tired? He said, no, I'm not tired, but my whole body is paining me. Yeah, so he defines tiredness for me, but says he's not tired. Yeah. So, tramadol is a drug of abuse. It's a painkiller. Yes. Stress can give you pains in your body. It can make you have pains in your body. Yes. But that is not the solution to solve the stressful situation. Okay. So tramadol, like alcohol, is also a depressant. In the long run, tramadol will give you depression. Tramadol, unfortunately, activate is what we call psychoactive substance. Psych, I said, means mind. Active means it can change it. Yeah. So psychoactive substances like alcohol, tramadol, heroin, cocaine, these change the way we think, feel, or behave. And once we start them, they are addictive. And you might not be able to quit. Now studies have shown that there are people who are born to become addicts. When they start using drug of abuse, they can't stop. Okay. There's no way to know who will get it until you get it. So, that is not the way to go. Tramadol is a prescription drug for some moderate to severe pain. Okay. And let a doctor prescribe that for you.
Okay, so what happens to temperament. You know, we all have temperaments. There are some people who are cholerics and stuff like that. Does that also have an influence on one's ability to easily get stressed or not?
Yeah, your personality predispose you to, stress.
Okay.
So there are people who are always living on the edge. Yeah, they are more likely to get stressed.
Okay.
There are people who are lucky-go-lucky, happy guys.
Yeah.
Nothing really affects them. They are more likely to take things in and get less stress.
Okay.
So yes, it's important to know who you are. And one approach we tell people who are edgy, who live on the edge, who are prone to stress is that delay your response. So yes, you told me something nasty today. I would really want to give it back to you, but I'll do it tomorrow morning. Yes, I'll do it tomorrow morning.
The fight is over. There's no point.
Okay, so when you realize that, with time, you take a different view. Probably that is the best view, and you don't need to respond immediately. So that delaying of your response, I'm not saying don't respond, just delay the response, will help you get a better response, because I may say something to you that I have to come and apologize again, and that is another stressor. Yeah, so by delaying my response, it will be measured, it will be less stressful for me, and it will improve our relationships. Yeah.
Okay, so what are some of the various reasons why someone will actually get stressed earlier than the other?
Yeah, it's all about our responses. So stresses come to all of us, like I said earlier. So how we respond to the stressor is the main difference between who gets stressed and who does not. So when we learn how to respond to stresses, one, by identifying the stressor, then we learn, the right tool to remove the fly from the TV screen. When you have the right tool to solve the stressor, then you are less likely to get stressed.
Okay.
Yeah.
Okay. So we are about wrapping up since time is almost up. And my last question is positive mindsets. And then last week I heard about psychology of happiness.
Yes.
Does it also help de-stress?
Yes. It is all about actually de-stressing.
Oh, really?
The positive mindset. Yeah, because, and like I said, delay of your response, or some would say delay of gratification. When we have a positive attitude to life, when we know that things do not just happen only today, if we are able to think through issues, okay, we are more likely to manage stresses. Yes, something happened to me, I know I'm going to jail. Okay, let me go through the court process. I may or may not end up in jail.
Yeah.
So, but if I just begin to think that today I'll be in jail at all costs, then of course I will not sleep. But if I think that there's a possibility, there can be a presidential pardon, there can be something else. So yes, I'll do something towards it, work towards it. So if you always have a positive outlook, then you are less likely to be stressed. And positive living, positive outlook to life is always what we want people to do. So there's actually a course in the universities now, how to live a happy life.
A course?
Yes,
on
a
its
course
own.
on its own, because we need it. We all need it. We are only living very few years on earth, and it's best to live that
then
few
it's not
time.
fair being a course for a selected few. Everybody should actually jump at it.
Yes, but there are courses in entrepreneurship in the university. It is not for everybody. They ask you to choose it.
Oh, but this has got to do with life, you know.
But entrepreneurship is not for life.
It's for life. But
So yes, so the university, like I told you, is to train your mind. We don't force things on students.
Okay.
So yeah, it is available. We will announce it. Come and listen. Come and learn.
Yeah.
Yes, and students don't always come.
Really?
Sure.
How to live a happy life and you will not go?
Sure. But students, we do programs how to find a job after school, and students don't come. Yeah.
Okay, that's so serious. Okay, we're wrapping up here, and that has been This has been HealthAfrik, and I have with me here Dr. Eugene Dordoye. Yeah, I know I got the pronunciation
Sure.
right. Okay. We've been talking about job stress and mental health, and unfortunately we've come to the end of another edition. I know you have actually learned a lot, but when you're having the program at University of Allied Sciences, please try and go. How to live a happy life, it's very important because stress happens to everyone, and we need to find ways and means to de-stress. You can take a walk, you can have a positive mindset, and always know that your temperament has a different way of coming up with how you deal with your stress. So thank you very much. This has been HealthAfrik. Hope to see you next week. Please. Thank you.